Welcome to HMS, let the power flow. Feel the rhythm in your veins. Every rapid nitro flame.
So the first video, the first area that we're going to focus on is how do we classify sports injuries, okay? So sports injuries can have 5 different classifications and they're all going to be a mix of 3 different sort of overarching categories. So I'm going to put them on the screen in categories. So our first category is we've got direct or indirect injuries. When you get injured, your injury that you're specifically looking at is either going to be this or this, okay? You could have both at the same time at different points in your body, but when we classify an injury, it's either a direct injury or an indirect injury. So you may want to like box them in your book or something to show that they are one or the other. So a direct injury is an external force making contact with the body, and the point of contact is where the injury occurs, okay? The example I wrote here is that if you are batting in cricket and you get, without pads or maybe it got between the pads, hit in the leg with a cricket ball and it causes a contusion on the thigh. Contusion is the fancy word for bruise, if you didn't know, okay? So where I got struck by the cricket ball, I now have a bruise there. That is a direct injury, okay? If I was a boxer and I got hit in the face and my eye swelled up, guess what? That's a direct injury, all right? If I am standing in the middle of a field and I get struck through the shoulder by a javelin, well, that's a direct injury. Don't ask me why I'm in the middle of a field and getting javelins thrown at me, but they're all direct injuries, okay? Indirect injury, on the other hand, is either caused by internal forces, which could be due to like overtraining or fatigue or any other number of issues, or it's external forces, but the site of injury is away from the point of contact. So this time I've given you 2 examples to try and explain it. So if I am like running and I trip and I reach my arms out to catch myself like I'm falling, but I reach my arms out to protect my head, but when I fall on my hand, I dislocate my shoulder. Okay, that's an indirect injury, all right? I may have a direct injury on the hand from where I landed, but then the forces traveling up through my arm here have found a weakness in the shoulder and then the shoulder dislocates. Alternatively, another way to look at an indirect injury is like if a sprinter is, sprinting off the blocks and then they tear their hamstring, okay? At no point did the hamstring actually make contact with anything. That is an indirect injury too, all right? So it's either from internal forces or it's from external forces, but the injury site is away from the direct contact. All right, so our next classification group we've got is soft tissue injuries and hard tissue injuries, okay? So soft tissue injuries are any injuries that occur to muscles, ligaments, tendons, skin, organs, and cartilage, okay? So think of the things that are soft and squishy in your body and they get hurt. We do have 3 grades of soft tissue injuries. So you may have heard, grade 1, grade 2, grade 3. These are mainly related to tears of ligaments or tendons. So we've got grade 1, which is a slight stretch or a tear, a sprained ankle, that kind of stuff is just grade 1. You sort of walk it off after a week or 2 with proper RISA protocol. Grade 2 is partial tear. Now, partial tear can range, okay, depending on what the ligament or tendon is. It means that it's not a complete tear. It can usually, most of the time, be rehabilitated, but can take months and months. So, for example, my Achilles tendon was a partial tear, so it wasn't fully torn, but that was 9 to 12 months of rehabilitation for me, and I'm still in pain now, 4 years later. Then we've got our grade 3, which is our full and complete tear, which obviously will require surgical intervention because the tendon or ligament is no longer attached to the bone. So examples of our soft tissue injuries, just think cuts, rolled ankles, so stretching of ligaments and stuff, tearing an ACL, if you get punched in the face and your eye swells up, that's all soft tissue injuries, okay? Then we've got our hard tissue injuries, all right? So hard tissue injuries are injuries to bones or teeth, okay? Once again, there are classifications here. So we've got hairline. You may have heard the term hairline fracture, which is just the fancy way of saying stress fractures from overtraining, etc. Green stick fractures means that there's like a partial fracture in the bone. A simple fracture means that the bone is completely snapped, but it is contained under the skin, hence the word closed, all right? So you can have a simple fracture in your arm as long as the skin is intact. A compound fracture, however, is when that same bone fractures and the bone is now protruding through the skin, okay? And then our worst one we've probably got is complicated fracture. So imagine that if you fractured a rib and then the rib punctured your lung or your heart or something. So you've got organ damage along with the fractured bone. So examples of hard tissue injuries, we've got, fractured radius, dislocated shoulder. Okay, so even though a bone is not actually broken when you dislocate a joint, it is counted as a hard tissue injury. But you can also see how that is also partly a soft tissue injury. So if I did dislocate my shoulder, the humerus coming out of my shoulder girdle is going to be classed as the hard tissue injury. But for that to come out of the shoulder girdle, it probably had to stretch or tear some ligaments. So we've also got soft tissue injury there too. And then like stress fractures in your shins from too much training, recovery, etc. So that's soft and hard. And we've got one more way to classify injuries. Okay, so our last classification is an overuse injury. All right, so we had direct and indirect, soft and hard, and now we've got overuse. So some injuries will be overuse and some will not. Overuse injuries are very simply injuries that gradually develop over time from either too much training volume, using poor technique, or lack of recovery, okay? These things don't happen overnight. They happen over, weeks and months of doing something wrong, and therefore you end up with an overuse injury. So common examples, the main one, major one is going to be tendinitis. So tendinitis of any of your tendons in the body, okay? Anything itis just means inflammation, okay, or swelling. And in this case, it is the tendon, okay? A common example would be tennis elbow, okay? But another one would be like runner's knee, which is patella tendinitis. Other examples include plantar fasciitis, which is obviously inflammation and swelling of the fascia that runs underneath the foot. Stress fractures, which we talked about before. Bursitis, so you've got bursa in your joints. So a lot of people get it in their shoulder to the point where they can no longer lift their shoulder up because it just impinges and it hurts, okay? Because there's a big massive swelling in there that shouldn't be there. Shin splints is also a very common one, especially in children who are developing. They're doing lots of running and stuff. Obviously not following a rigid recovery protocol because you're a kid, and then you get shin splints. So that is the end of this section on classification of sports injuries. Okay, sorry, I know I said I was finished, but I really should have given you an example as to how you put this all together in response. So an example, a rugby league player is cut on the face during a tackle, all right? So old mate's gone in, he's tackled, he's made contact with the player at some point, maybe the player's fingernails or teeth or something have come in contact with the rugby league player's face and now they've got a cut under their eye, all right? How do we classify this injury? Well, it's a cut, so cuts occur to soft tissue injuries. The cut occurred from being struck by the other player, so it must be direct. And this is not an overuse injury. So in your response, you would say that the cut to the NRL player or rugby league player's face is a soft tissue injury caused from direct forces. Yeah. All right. So in our second section, looking at management and prevention of sports injuries, we're looking at the assessment of injuries and the procedure that we use to assess a sports injury, okay? The very first thing I wanted to put up before we get to the assessment part though is 000 if life-threatening, okay? Obviously we are referring to sports injuries here, okay? However, if you happen to see an athlete who has complicated fracture and there is bones pointing out of their skin everywhere and they're bleeding, you're not going to go and ask them, where does it hurt? You're going to call the ambulance straight away, all right? Now, assuming it's not a life-threatening injury and there's no visible immediate danger to them or yourself or anyone else, okay, common sense, we're going to move on with TOTAPS, all right? Please remember the acronym, it will help you with the procedure. So the TOTAPS procedure goes through, these are basically step-by-steps, hence the little arrows, okay? You don't go to the next one if the previous one is no good, okay? And if at any point it is no good, then you either need to A, refer them to a doctor or a physio, or take them to a hospital, or call 000, okay? Anyway, first step, talk to the athlete, okay? Where does it hurt? What did you feel? What did you hear? Has this happened before? Okay, so gathering information is really, really important to help you move through the rest of the procedure, and then ideally help you start to help treat them, okay, depending on your training level. So we've talked to the athlete, we've found out what's going on. Okay, let's move on. Now we're going to observe the injury, okay? We're going to, ideally, if it has happened on an arm or a leg or on the sides of the body, we can compare left to right, okay? In the middle, well, tough, all right? But sides, we can definitely compare left to right, all right? Can you see, and what we're looking for is any bruising, swelling, or deformity, all right? So bruising is indication that there is bleeding underneath the skin. Swelling obviously means that there is inflammation, and if inflammation comes up straight away, then you know there's definitely going to be some soft tissue damage or potentially hard tissue damage underneath the skin. And deformity, well, that's definitely hard tissue, okay? Because our skeleton gives us our structure of the body, and if my arm has an extra bend in it here, well, that's probably not good. And obviously, if you are suspecting that that is bad, you would stop TOTAPS and call 000 or get them to a hospital ASAP. The next step, we're going to touch. So we're going to touch gently around the area. So I don't mean like, if they're saying, oh, my arm hurts here, you're not going to go, where, here? Okay, you're going to start up away from the injury. Does this hurt? Does this hurt? How about here? What about here, just below the elbow? Okay, and then you go the other direction. Okay, does it hurt here? What about if we do this? Does it hurt here? So you're trying to find out how large underneath the skin level the injury actually is, okay? The reason we do this is because if they happen to have like a fracture here, okay, and it's not really swollen, it's not really bleeding a lot, and you're touching here and they're sort of like, yeah, that's fine, but the instant you touch down here on the radius and you can kind of feel this bone actually moving, and it shouldn't be moving, well then you're like, okay, this is pretty serious. Let's stop there. You're not going to keep touching them. I suspect you have a fractured radius. Let's get you to hospital, okay? And I did write that here. So as you're touching them, does it cause them any pain? Can you feel any heat? So heat is a good indicator of injury. Can you feel any actually fractured bones that are moving under the skin and they shouldn't? And if you suspect the fracture or dislocation, you're going to stop TOTAPS and you're going to call 000. So let's move on. Let's assume we've gone through talk, observe, and touch, and everything's hunky-dory, all right? Next one we're moving to is active movement. So can the athlete move through their full range of motion unassisted, okay? So let's say we're talking about a shoulder injury, and you're like, okay, well, everything looks fine. I've touched around your arm, I've touched your chest, your back. You don't seem to be in pain or discomfort. Can you do some arm circles for me? So the athlete might do some small circles like this, and then you might get them to progress up into some larger circles like this. And what you're looking for is any sort of signs that they're still injured, okay? So if they do this and they go, well then probably shouldn't be getting them back playing sport, okay? Clearly something's not good, all right? But if they're like, yeah, that's okay. Yeah, no, it feels good, okay? Well, we could trust them, but because we're thorough, we're not going to trust them. We're going to move on to the next step, which is our passive movement. So now you're going to grab their arm and move it through full range of motion for them. Now, the difference here is that when you do this, because your nervous system is really good at protecting you from things like pain, I can move my shoulder through a full range of motion and be like, yeah, this doesn't hurt, but I'm not really moving it through a full range of motion. If someone else was to grab my arm and move it through a full range of motion, that might cause pain and discomfort. So as the assessor and as the person who's running the TOTAPS procedure, as you do this with your athlete, you are looking for signs of pain or discomfort, usually in their face or their breathing or, just those signs that someone's hurt. If you can do that to their injured site and they're looking great, okay, let's move on to our skills test, okay? So now the athlete's going to complete increasingly harder skills to demonstrate full capacity, okay? So for example, if we had a soccer player, and let's say they injured their ankle or knee or hip or whatever, okay, it doesn't matter what part of their body they're injured. Can you just go for a walk around the sideline? How's that feel? All right, move up into a run, move up into a sprint. Okay, pass and kick me some balls, and then do like a stop and turn. And then if they can do all of those things without causing pain or discomfort, well, guess what? Their injury is not severe and they can return to play. Excellent. That's what we want. But that is the procedure to assess whether an injury is serious and a serious nature where we need to refer them or potentially take them to hospital or call 000 ourselves, or whether the athlete is going to be okay and they can return to play safely without causing themselves or others harm. All right, so that's our second part, looking at the assessment of injuries.